Perfect.
Then we'll get some people on as they come.
Sounds good.
Awesome.
Sorry, one second.
Yep.
Go.
Awesome. So we're just going to start in a couple of minutes. We're just going to wait for everyone else to trickle on, and then we'll just get started.
Sounds good.
We're just going to wait for a few minutes, everyone, just to get everybody on there and started. All right, we'll just get started then, Jill. All right, I just want to say hi and welcome to our fourth webinar of Webinar Week series at Cortha Care. We decided to do these webinars to kick it off our webinars with many different topics that you've asked us to speak about and things that you may have been having trouble with at home, especially since, you know, we weren't able to see you for the past 8 weeks. So a lot of these webinars are by request of patients. So we want to thank you first and foremost for sending those requests, and hopefully you'll get a lot of good information as you did in the previous ones as well. We've had great success with our webinar week, and if there's anybody that is looking to get the recordings of previous webinars or the next 2, so today and tomorrow's, you can shoot us an email or call us and we can send those over as well. They'll be posted on our YouTube page in the next few weeks as well. So I'd like to introduce our panelist today, Dr. Jillian Edgar, and thank her for joining us. She is a chiropractor and also an acupuncture provider at Cortha Care, and she's also certified in the Webster technique, which is a technique specifically made for pregnant women to help them during their pregnancy with aches and pains that we naturally experience, also to help baby as well. So if you have questions about that, you are more than welcome. Or any questions at all, you're more than welcome to just click on the Q&A box and input your questions, and we will answer those at the end of the webinar. If you have things that you want to chat about, there is a chat box as well, and you're able to chat with all attendees and panelists, and you can still have some conversations, some good conversations in there as well. So I'll go back to introducing Jillian. So Dr. Jillian Edgar started with us back in January. We are so happy to have her. She's been an absolute pleasure to work with, and our patients just love her, and so does our staff. So it's been a short little while, and then of course, as we know, COVID happened, but she's been a brilliant addition to our team, and we've been you know, seeing patients that need a little bit more urgent care, and she's been so great with them. So just wanted to say a big shout out for that and a thank you for that as well, Dr. Edgar. So today's topic is hip pain. Don't lie, hip pain during pregnancy. And Dr. Edgar has come up with a vast amount of really good information that she'll be relaying today. So without further ado, here's Dr. Jillian Edgar, and I'll let her take it away.
Hi, everybody. For those of you who haven't met me yet, I'm Dr. Jill. My head is super big in this frame here, but it's very nice to meet all of you. Yeah, so I figured in the famous words of Shakira, let's get those hips moving. And this applies for everybody, but I just found that a lot of my pregnant patients are having some tricky pain with their hips, which is completely natural, but not normal. So let's fix that. But these stretches that we're going to go through today absolutely apply to everybody. So I hope you like what we have to offer. All right. Okay, so I'm just going to move this over here. Okay, so kind of our agenda here. These are the things I'm going to cover today. So why do I have hip pain? It could be a host of different things, but I'll give you some pretty common ones that I've heard lately. And how does hip pain occur? I'll just explain to you a little bit about how the hips work and why we think that that is becoming more prevalent, especially now with us, a lot of us either working from home or being at home due to COVID-19, which is both a blessing and a curse in some ways. Why is my pregnancy making my hips hurt? So we'll touch on that a little bit. And then let's work on some stretches to get rid of that pain, because that's the goal for today. And I'll give you some tips moving forward to try and prevent that from coming back or starting if you're just looking to be proactive, which is fantastic. And then there'll be lots of time at the end for questions, and we'll talk about Ryan's seminar for tomorrow too. Okay. So here's some common ones I've been hearing lately. So do any of these sound like you? You know, the Netflix marathoner is sitting on the couch a little more than normal, which is no judgment. I'm doing it myself too. Are you a new home office worker, kind of recreating your office workstation? Have you started or stopped a new exercise program due to COVID-19? Maybe you're doing some home improvements, so you have a little extra time. And then now that the weather's starting to get a little bit nicer, maybe you're out doing some spring yard work, some gardening, lawn care, tree trimming, flower beds, you know, all of that. Or maybe you're pregnant, you're kind of reaching that second or third trimester especially. Yeah, so those are some super common ones that I'm hearing right now. If any of those sound like you, maybe drop a message in the chat box there. Okay, so hip anatomy. So I'm not going to bore you with all the scientific things, but I just want to show a couple of things here. So on the left, we've got good posture, and just beside that, they're calling it bad posture, but I'm going to say more common posture. So typically when those hips get really tight, your pelvis wants to shift into a forward position. So sometimes it can be one side or the other, and sometimes it's both sides. So typically this happens when we're sitting a little bit more than normal, which is common right now, obviously. But like I said, completely normal. It's something that we see all of the time and something I even experience myself. But when those hips start to roll forward, you really start to notice potentially some low back pain, some hip pain. Sometimes it's front of the hip pain. It's a little bit different for everybody depending which muscles are involved. But we really want to work on bringing those hips back a little bit. So again, the one at the left side of black shorts, this is the common posture, but the one on the right is what we want to get to. So we want to work on bringing those hips back a little bit. And I just want to touch on pregnancy just because it's a slightly different case, although same outcome, essentially, same thing. Those hips are shifting forward a little bit more than we'd like them to. Which does make sense. I mean, you're growing a small human there, but it does put a little bit of extra weight on the front side of your body there. So it does cause those hips to roll forward a little bit. And then on top of that, the hormones in your body start to change to make it easier to give birth, which is a good thing. But it does mean that things are a little bit more elastic, so it causes things to roll forward a little bit further. But this is, again, completely normal, but there's different ways that we can combat it so that it's not as painful for you moving forward as well. Good. Okay, so same thing with tight hips. Sometimes it presents as a couple of different things. I would say low back pain, buttock pain, knee pain are typically the most common, but sometimes it does present as abdominal pain. There are some muscles that cross from the thigh up into the abdomen that can become painful as well. So it can present a lot of different ways, but they usually all stem from tight hips. So that's just something to notice moving forward. Okay, so hip hip hooray. Let's learn some stretches today. You'll have to kind of deal with my goofy jokes. Unfortunately, that's something I can't get rid of. But let's give them a go. A couple things before we get started. So we're just going to do stretching today. Strengthening is always a good thing to do as well, but I think stretching is something that anybody can do at home safely. But the thing with stretches, they're not supposed to be painful. So even if you can stretch further, you don't want to stretch into a painful range. I usually tell my patients to push themselves into a stretch where they're feeling a bit of a pull. It might be a little bit uncomfortable, but you don't want it to be painful. Especially if you push it too far, then it's going to be painful for a few days, and we're really trying to stop that from happening. So typically I hold each stretch for about 15 to 30 seconds. I'm going to show you a little bit faster today just for time efficiency. But if you can't even reach 15 seconds, that's okay. Don't be discouraged. 10 seconds is okay as well. And we'll kind of work up your time as you go. But stretches are usually somewhere between 1 and 3 times per day. I usually put 2 to 3 when you're first starting out. You need a little bit more work, but that's normal. As things start to loosen up, then you can do them a little bit less frequently as well. But you don't want to hold too much longer than 30 seconds. You can probably get up to a minute on some, but any longer than that, and we're overstretching the muscle, and that's something we don't want to do either. Okay, and if any of these stretches are causing a sharp pain, a shooting pain, or just pain in general, let's stop, and that's something that we can discuss moving forward as well. Perfect. Okay, so you get to see my face a whole bunch here. So I'm going to show you a stretch. Thank you. It's kind of weird seeing yourself on screen. So I'll show you a couple different progressions here, and I'll show you which ones are safe for pregnancy as well. So bear with me. I'm going to kind of move around the office here and see what we can show you as we go. So the first couple of stretches here are usually going to require a chair, unless you're pregnant, in which case we'll do some of these on the floor. But we're going to start standing if you're comfortable. If not, absolutely anybody can do the floor stretch that's seen in the upper right quadrant here. Whichever one you feel like you're getting a better stretch, that's the one I would recommend doing. But I'm going to show you the standing one first, and then I'll show you the kind of sitting down one here. So bear with me. See what you can see here. Okay, so I'm going to start with a chair here. Okay, so basically, you're going to miss half my body here. So you want to bring one leg up at a time, okay? You want to point your toes up towards the ceiling, and you're just going to lean those hips forward, keeping your low back nice and straight. You can't see my back, but it's semi-straight. Good. Same thing, you want to hold for about 15 to 30 seconds. You can lean forward and hold onto the armrest if that makes it easier as well. You don't want to see you falling at any point. Okay? Good. Okay? And if you feel like a chair is just too high for you, you can use a step, or maybe you have a stool for the bathroom if you have kids. Something like that, a little bit lower will be a little bit easier as well. Okay? And
you're a trooper.
Oh, yep, we're gonna learn today. Okay, and if we prefer the ground one, this is my go-to with pregnancy, unless your belly is getting quite large, but just be easy on the leaning forward. You're gonna try and touch your toes as best you can, and same thing, just lean forward. Okay, pulling a little bit on the toes is good. Good stretch for the calf as well, but you can get a little tight here and there. Okay, perfect. All right, what else do we have here? Okay, so the quadriceps are not so bad. So essentially those are your front of your leg muscles. I'm gonna do it here. Might want to use the back of the chair for stabilizing at this point, okay? You're just gonna pull your leg up towards your butt and pull. Pull back just a little bit. You don't want to be leaning way like this, then you're hitting a different muscle. You want to stay pretty straight. You can do a little bit of a pull. Okay. Same thing, 15 to 30 seconds a couple times throughout the day. Good. And those should be safe for both our regular patients and our pregnant patients. You're gonna see a lot of my stomach today. All right, this one might be interesting. All right, so let's come this way here. I'm gonna show you standing this way first, and then I'm gonna show you on the wall, okay? Just a little bit easier to see, okay? So we're gonna start on the right side. So you wanna bring your right leg behind you, which you probably can't see here. Let's try and shut back a bit. Okay, that's still a little bit hard, but okay. So you're gonna have your right side on the wall. You're gonna bring your right leg behind you, and you're gonna lean into the wall. So you can use your arm to stabilize you, being nice and careful. You only need to be about a foot from the wall. It doesn't have to be very far. But you should feel a stretch in through the side of your back hip. Okay, so it kind of looks like this. Again, it's kind of hard to see here, but okay. So you bring your right leg behind you, and you're just gonna lean away from that hip. I do recommend you do this on the wall because you start to lose your balance, myself included. But same thing, hold for about 15 to 30 seconds. If you can't seem to figure it out, I had a hard time with it. I can send you a video as well, which makes it a little bit easier.
Would you recommend both sides, even though the pain's only on one?
Yes, absolutely. We want to keep those hips even as best we can. So always, these stretches should always be done on both sides, even if you only have pain on the one side. Perfect. All right, so this one's seated, so it's a little easier. Let's start with this one. I feel like it does get a really good stretch. This is my go-to exercise if you're having side hip pain, if you're having that mid-area low back pain where you're kind of right before your butt, right about here. This is a good stretch, okay? So you're gonna bring one knee up. You're gonna sit it over your other. I'll bring it down a little bit here. Okay, just like this. Okay, you can stabilize with your knee, but you don't need to push it down. You can just leave it as is, and you're just gonna lean forward. You should feel the stretch in the back of your butt, maybe around the side of your leg as well. Good.
That's always the good one. I find
Make sure you do both sides. Yeah, it's great. You can do it at work, you can do it at home, while you're watching TV, whatever's comfortable. It's a really good one after a long walk as well. Good. All right. And the one in the other picture, unfortunately, is kind of hard to see. It's one you really need to see from above, but that's kind of tricky. So basically, you're going to bring your knee up towards your chest while you're lying down, and you want to try and bring that knee over to the side a little bit. So basically, I tell people to try and reach for their opposite side shoulder. Yeah, sorry, unfortunately, that one's the tricky one to show. This one's a bit of a balancing act. The one with the chairs is a little tricky to show just on a video because you can't really see from the side. I should have brought a second person with me so that they could videotape as we went, but that's okay. So we're gonna focus on these ones on the ground, but equally good stretch. I like both.
And the pictures are very clear, so if there's any confusion, you can always give us a call, or we can kind of help you with a Zoom call as well.
Absolutely. Actually, we prefer it.
Yeah.
Okay. So pick a knee. Doesn't matter which one you want to start with. Okay. You're going to bring one up. Okay. So you're square. Maybe I'll show you from the side. That might be easier. Okay. One knee behind you, foot flat on the floor. Okay, one knee in front of you. You're just gonna lean forward. You should feel the stretch in the front of your hip here. If you're feeling it in the front knee, bring that knee forward just a little bit further. Okay, good. If you want to get a little bit of a deeper stretch, you can bring that arm, sorry, it's kind of hard to see. Bring this arm over your head and just lean towards the side a little bit. Okay, I know it's a little hard to see, so I'll show you on this side as well, just to keep things even. Okay, so you start on your knees. Bring your knee up. Good. Make sure that other leg is flat on the floor. Keep your foot flat out. Okay, you're just gonna lean forward. Good. Okay. Same thing, you can add that arm in from the opposite side and lean a little bit to the side. All right. Okay, so now we're going to do a stretch for the inside of your thigh in that groin area. Again, a pretty tight muscle this time of year. Okay. Ooh, these pants are a little tight. This may not go well. Probably should have warned you that you had to wear loose clothing today, but that's okay.
Summer's coming next week, so we'll be in shorts.
I hope so. That would be fantastic. All right, so you want to bring those feet together. Okay, try and bring them as close as you can towards your body. I can't get very close because my pants are too tight, unfortunately. But do what you can, no problem. Okay, you just want to push those knees down towards the floor a little bit. Okay, I kind of like to hold my feet together and push with my forearms. You can do that as well. Okay, but for our pregnant patients, if this is too difficult to get up and down, I'll give you an alternative here. Ooh, I'll bring this up a little bit. Okay, so you can just start in a squatted position and you can kind of lean side to side if that's easier. Okay, and you can even get a little bit lower into a deeper squat as well. Again, my pants are a little tight. Bear with me here, but same thing. You can kind of use your forearms to just open those hips up a little bit. Same thing, you can rock a little bit if that's easier. It's up to you. Good. Kind of look like a frog, but good. All right, what else do we have here? All right, and our last one. So when that hip starts to shift forward, it usually means that the butt muscles aren't working as hard as we would like them to. So I'm gonna try and show you. This one might be a little hard though. But, so we really wanna work on getting those butt muscles moving. So, okay, so see how my pelvis, I'm going to accentuate it a little bit, wants to sit really far forward. There'll be an arch in your low back, which is what we're trying to avoid for this activity. So to flatten out that low back area, we want to bring that pelvis this way. So everything wants to sit forward. We want to bring it back. It's kind of hard to see, but we'll try. Okay, so usually what I tell patients is if you clench your butt, everything will naturally flatten out this way. So you want your back to be flat on the floor and your butt to be contracting. So if you squeeze those glutes, that will keep it there. Okay, I'm gonna make this a little bigger. Okay, so once we got that down, those are called pelvic tilts or butt squeezes. It depends how you want to call it. I remember butt squeezes, it works for me. But what works for you, that's you. Okay, so you want to squeeze your butt. You're going to bring your hips up off the floor. Okay, so again, squeeze those glutes. And you want to bring your hips up into a bridge. You want to keep your low back straight, which you can't really see. Ooh, you made it worse. Okay, so again, squeeze, that pelvic tilt, and up off the floor. You can have your feet about shoulder width apart, and you want to try hold it, keep that back flat, hold for about 2 seconds or 1 breath, I say, when you get to the top, and then come back down. Okay, let's go a little bit faster. So squeeze those glutes, up, take a breath, and come down. Okay, you typically start with about 10 of those. See how the first couple days go, and then you can increase your reps a little bit higher, but that's something you would want to discuss with a provider, or depending on how things are functioning, you might be able to up it yourself if things are going well. Otherwise, you should see a provider to kind of manage that.
So we had a question, and the question was, for later in pregnancy, are these still okay to do lying flat on your back?
Yeah, that's okay. You don't want to stay there for a long period of time, absolutely. But as long as you aren't engaging your core, you're engaging your butt muscles instead, then they are absolutely safe.
Perfect.
So if you clench your butt, it's hard to clench your core and your butt at the same time. So that's why I have people clench their butt first and then bring your hips up.
And do you want to talk a little bit about how these would help not only with hip pain, but even during labor and post-pregnancy as well, and why it's important?
Yeah, absolutely. I'm just gonna sit here.
Yeah, please. Take your time.
All the blood is rushing to my head. Sorry about that. Yeah, so these are really good for pre-labor for sure. Helps open up those hips, which makes labor a little bit easier. You definitely want to get your pelvic floor as loose as possible as well. So that one where we're sitting, where it's opening up, those are your external rotators. So they move your hip outwards. That will help with labor. So yeah, so come back a little bit. So these are your hip external rotators. So they move your hip outwards. So any extra space you can get during labor, that's excellent. So the more you can rotate your hips, the more space you have to kind of bring your baby into the world, which is good. And it helps keep everything else a little bit looser. So as contractions come, they're coming whether you like it or not. And that's okay. That's a good thing. But we try and keep those muscles as loose as possible to just make the process that much easier.
Perfect.
Excuse me. Choking on my own saliva. All right, so some tips to prevent hip pain. Get up and move your body. That is your best defense. I don't know if you've seen the meme with this girl doing her dance. It's very funny. If you haven't, definitely look it up. But any kind of movement is a good choice. I mean, maybe don't do any extreme activities if you're pregnant. But getting up and go for a walk. Go for a run. If you're an avid runner, don't start running in the middle of a pregnancy. But if you're a runner before that, you're certainly more than welcome to continue. Go for a walk, go for a bike ride, whatever it is that works for you. I know a lot of gyms are closed right now, which again is tricky, but take advantage of the nice weather and get up and go for a walk. You take the stairs if you're still working. It doesn't have to be an hour-long thing that you set out for yourself. It certainly can be. But yeah, just get moving, do some stretching, anything that we talked about today that is something that you felt a good stretch with, give yourself some time to do that as well. If your hips are really bothering you, if you are a side sleeper like myself and most people, I think, if you're a back sleeper, good for you, because I'm impressed. That's harder than it looks. Most people are tummy sleepers or side sleepers. Try and sleep on your side and put a pillow between your knees. That will open up the pelvis joints a little bit, which can take some of that tension off the hips, which is really good. Supportive footwear is big. absolutely for hips, for knees, for low back, all of it. Try and get a running shoe. If you have to wear work boots or something like that, that's totally fine. Make sure they have good ankle support. Tie them up. Don't leave them loose as you're going through the day. If you're wearing running shoes, try and get something with a good heel cup. So you want it a little bit deep where your heel is sitting so that it can't move as much. And same thing, make sure you tie up those shoes. That's really important. I know it's tricky, especially when you're pregnant and you're reaching the end of your pregnancy. Everything's a little more swollen, but do what you can. If you have to wear flip-flops, that's okay too. Just try not to go for long walks in flip-flops. Try and mitigate that. Take lots of breaks throughout the day. So especially hitting up those Netflix marathoners and home office workers, make sure you get up and take breaks once an hour, once every hour and a half, whatever it is that works for you. Even if you just go to the bathroom or go to the kitchen to get a snack, or, you know, do a couple stretches, whatever works for you. Just make sure you're moving throughout the day. The longer periods of time that you are sitting, it can aggravate your low back, your hips, sometimes your knees, depending on where you're sitting. But just make sure you get up and switch positions. And if you're pregnant, elevate your feet, especially at the end of the day. Just try and drain some of that swelling, especially in the ankles. Pretty common in the hands as well. Unfortunately, that one's a little harder to work with. And get adjusted. I'm a chiropractor, so I have to throw my 2 cents in. But definitely pelvis alignment is very important in making sure those hip muscles work. If those joints aren't sitting where we want them to, then the hip muscles will become aggravated as well. If you do stretching, sometimes the pelvis will realign by itself, but sometimes it doesn't. It is different for everybody. But definitely start with some stretches, see how you're feeling, and if things just aren't getting the results that you're hoping for, or something's just not moving how it feels, or how it should feel, or normal for you, definitely make an appointment with a chiropractor, physiotherapist, osteopath, athletic therapist, whatever it is for you, but get it looked at sooner as opposed to later.
And Jill, are you able to talk a little bit about the Webster certification? So why that's important? I know myself, I have that as well. I'm certified in Webster, yourself as well. And in Lindsay, there's pretty much, I think we're one of the only 2 that are, but I'm sure there's lots more for those people in other areas that are tuning in, and a little bit more about that, just in case people are curious about the Webster technique.
Yeah, for sure. So similar kind of conversation. So Webster technique is out there for pregnant mamas, but it's a way to get the pelvis in healthy alignment for child labor. Same thing, we treat a lot of hip muscles, a lot of low back muscles, just keeping everything moving as optimally as possible. It can help your baby sit in a healthier alignment. I'm not going to say that it will definitely move your baby. It will not definitely do any of that. But a lot of the times it does work. It helps, get that baby into a more healthy position for birth. But yeah, it's chiropractic treatment for moms or new becoming moms. It's our chiropractic treatment. So we do some adjusting, we do some muscle work, a lot of education, just trying to find ways to get you into a comfortable position. We can talk about just about anything you want to know. I've had a lot of questions for sure, but it's something that both Manju and I are passionate about. We love it. We've seen several patients. If you have any questions, please feel free to ask away. Kind of kept it brief there.
Yeah, definitely. When I was pregnant with Shyla, she was head up, so head facing upwards instead of head down, and I was getting adjusted at that point. Primarily, I would say the last 2 months, because that's when, unfortunately, she was positioned incorrectly, and getting acupuncture and pretty much the works at that point, because I obviously wanted to avoid C-section or any of the other things that get a little bit more complicated as best I could. But I echo with what you say as well, is there's no, it's not specifically going to necessarily change the position. It'll just help to open up the hips, and maybe baby will just naturally come down. You just want to do everything conservatively and safely as you can, just for the healthiest and least pain-free delivery possible.
Exactly.
So I mean, I guess I'm biased as well, but it worked really well for me. So yeah.
Fantastic. So thank you for joining us and bearing with my movement. It's hard to do. It's almost one of those things where you need a video camera. As bad as it sounds, walking around with my phone may have been easier. But I am such an open person. I accept all questions, criticism, the whole 9 yards. If there's anything we didn't cover or something that just didn't click for you, please drop us a message. I'm more than happy to go over things or make an adaptation for you if something's just not working. Yeah, let me know what you think.
Perfect. So we'll just wait for a couple minutes in case anyone does have any questions that they want to send through. But I want to say in the meantime, thank you so much to our panelists, Dr. Jill, for again educating us. And every time I hear a new webinar, quite honestly, I learn a lot. And you know, being a new grad, you have all that good information there. So I appreciate you doing that for us and for the clinic and for everybody today that's listening. So thank you for that. Just gonna see there's a little bit of a question here, I think, in the chat box. Okay, so another question was, other than the hip openers mentioned, are there any stretches you'd recommend to help during labor specifically?
I'm going to let you cover that one since I haven't personally been in labor myself. So I figure maybe Manju is better.
Okay, so that's a really good question. Probably a very in-depth question as well. Sorry. Okay. And so any specific stretches during labor? So quite honestly, when you are in labor, depending on, you know, if things go to plan or they don't go to plan, which happens a lot of the time, and maybe you're on medication, epidural, so on and so forth. You have to keep all that in mind because quite honestly, you might not even be able to get off of your hospital bed, or you just are in too much pain to do a lot of movement. One of the recommendations is, of course, any sort of, like we spoke about, hip openers. So usually in your hospital setting, you'll do a little bit of a tour prior to you being admitted. So usually it's a month before. And often a lot of those hospitals have what we call like a peanut ball. It's similar to sort of that big bouncy ball that you can sit on, like almost like those chair balls. I can't remember the name exactly, but you sort of like ones that they have at the gym, like a huge ball that you can do a lot of exercises on. But they have a peanut shaped ball often at, you know, in labor and delivery. Those ones you can sort of sit on, and naturally your hips open up. So what you do want to do on those, if you're at a hospital that doesn't provide it, it's something that you can purchase online as well, and we can help you with that. But essentially you would be sitting on that. It actually feels pretty great. You don't need to move too far out of a room. If you're hooked up to something, you can still do this as well. And you would just do a lot of gentle rocking up and down on it. Again, if I look at it as like a peanut ball. It does look like a peanut, to be honest. And you sit right in that little groove in the middle, and you just do some gentle up and down rocking, and your hips naturally are spread apart, like your legs are spread apart. So it's a little bit more of a gentle motion. And then in addition to that, a lot of people will do some very gentle squats during labor. And those two are sort of the best go-to, because with squats, you want to hold on to something just so that your balance is there. You're safe while you're doing the squat itself. Of course, holding on to a chair is a great idea, but I would really sort of gravitate to that peanut ball, because that is sort of something that is a little bit more realistic to do during labor, especially when you have pain, you're hooked up to different things. you know, the work sort of thing. So you can easily access that and do a lot of just gentle rocking, and it feels good right away, which is nice. Often you'll forget about everything else during that time too. So that's sort of my advice. But again, we can send you some more information with some more if you'd like. Any other questions or concerns at all? I'm just going to look through here to see if there's anything else. Okay. All right. So, oopsies there. Okay. So if you do have any urgent care needs, so any sort of pain that's more than a 7 out of 10, you're thinking I'm going to emerge, or you're taking a lot of medication, we'd rather you not do that. And so would our colleges and the government. And so we are seeing urgent care patients for chiropractic and physiotherapy at the moment, and hoping that will change as well, you know, as the stages open up. We also are doing some virtual appointments in which, if you are not necessarily urgent care, we can still provide you with one-on-one appointments through a media like Zoom or FaceTime. It's sort of like our own program that's set up for, and it's private and it's encrypted and all that. So we can do appointments through that mechanism as well. All you have to do is give us a call or shoot us an email or text us, and we can give you some more information and book you in according to that. So tomorrow is the last day of our webinar week, and we're ending it off with a bang with Ryan, who's going to be talking about how to reverse the effects of bad posture, or what he calls T-Rex posture. So I know this is a big thing for a lot of you, a big concern, especially since we've been sitting for the last 8 weeks at our desks and not really ergonomically friendly. So a lot of you are creeping forward and getting a lot of pain in the neck and the shoulders. So if you want to tune into that, it is free tomorrow at 3 o'clock, and you can register at the link below. But other than that, if there's no other questions, I would like to say thank you to Dr. Jill for, again, hosting this and providing us with some great information. And we really miss you. So if there's any questions you have, any concerns, please feel free to email us, contact us. You're not bothering us. We just love hearing your voice. And if we can help you in any means possible, we're more than happy to do that until we see you again.
Absolutely.
So thanks, Dr. Jill, and thanks everybody else.
Thank you. So nice to meet you all.
Take care. Hope to see you guys soon.